Hey sisters, welcome back to the channel. My name is Sylvia if you are new, and if you're a returning subscriber, hey girl, hey. So y'all, it has been so long. Like last time I seen y'all, I was literally in the middle of first semester. I am currently going into third semester, so I have not seen y'all in months and I apologize. Things just really start picking up second semester, so like I was like, okay, wait, hold up, holiday. And I did record for y'all, like I was making videos, but it just was the getting out. Okay, so I'm just here to talk about all of the things, and I'm taking y'all way back to the last time I seen y'all at the end of first semester and bringing it all the way up to now, because so much has happened and it's just so crazy to think that I still remember the feeling of getting accepted into nursing school, and then I literally blinked and you're talking about we're in third semester. Like, graduation is gonna be my next life achievement. Like, wait. Okay, but anyway, so let's get into all of the things. Okay, so if I'm looking over here, it's because I have my notes, because when I tell y'all there's so much to like go back and tell y'all, it's ridiculous. So if I'm talking kind of low, it's because it's late at night and I don't know, like I feel like these walls be a little thin, so I don't want to be yelling at my neighbors. Anyways, back to the things. Okay, so y'all, let's go back to the end of first semester. So first semester, I don't know if I told y'all, but obviously I passed. Okay, period. I had clinical, I had fundamentals, and I had skills. And first semester was just all nursing checkoff, so it just hit you back to back with all these checkoffs and all the things. One thing I can say about first semester is make sure you find your groove in first semester, because that really sets the foundation up for everything else. Because second semester, it picks up. Like, it's a lot in first semester, but second semester is like, okay, like it kicks up another level. So my advice for first semester is to go in there, stay on top of things, deadlines, have a calendar, have a plan, and have a study method. Like, don't find yourself at the end of first semester still trying to figure out a way to study, because you're going to set yourself up all types of wrong for second semester. And unfortunately, we had a lot of people that did not pass second semester, and a large part of it was because they kept changing their study methods. Like, they didn't have a set pattern on how they wanted to study, right? So for me, the way I learn and study is I need 3 passes at the material and I'm pretty much good. So the first pass is in class, and that's another thing. Always make sure you go to class. Don't miss class, because they be throwing gems. So make sure you in class, okay, y'all? So the first thing is in class, getting that first pass, the notes. The second part of it is me going through the book, and I'm just like, I won't say completely reading, but like I was y'all, can I talk? I will summarize a paragraph into one sentence, and then I'll write that sentence right next to the paragraph, and I'll go through the book. That's the second pass. And then the third pass is me actually writing it on the whiteboard. So with me, that's kind of how it works. So I get that first pass from the professor, I get that second pass with the book. It's really the PowerPoint slides is what I really use, but at the same time, you do want to glance over the book and kind of summarize things, and that's the second time. And then the third time is me actually writing it on the whiteboard, and me writing on the I want to say blackboard, y'all. Me writing it on the whiteboard, that's what really just tie in all the information for me. So make sure you go in and you get a study method that works for you, because that's that can be make or break in second semester. So first semester pro tip. Moving on to second semester. So second semester we had so many more classes. Okay, so we had leadership, we had mental health, we had clinical, we had med-surg, our first med-surg, and we had a class before leadership. What was it? I can't remember what it is. It'll come to me. But so for the first 8 weeks we had one class, and then for the last 8 weeks we had leadership. So as you can see, second semester kicked it a notch, right? I had second semester, yay. I didn't necessarily find second semester challenging, even with like the pickup on the courses, on like the course load, and that's because I already had a foundation in the study method. Like I didn't find med-surg challenging at all. I got a B in med-surg. I did have like one like low grade, like low, I mean recoverable, but it was low, okay? And I believe that was, and it wasn't fluid and electrolytes. You would think I think it was immunity, infection and immune. Yeah, it was infection and immune. Not because I didn't know the material, because here it is for second semester, there you have to know your meds. Like first semester you can kind of get by, second semester it was all meds, and I underestimated meds. I was like, whatever, and I would always put it, you know, to the last minute, or put it to the end of my study time, and that's why I didn't pass the exam, because I knew the material but I didn't know the medications. So make sure you know your medications. Obviously you're not gonna remember all of them, but try to come up with acronyms or little stupid sayings that stick in your head, like whatever it is you got to do to make sure you know your meds, because that for me and a lot of my classmates was the difference between a B, a C, a A, a B, was knowing the meds, because they will sneak up on you, especially infection and immune and fluid and electrolytes. Stay on it, okay, y'all, stay on it, because I know a lot of people, and here we go again, we lost some people because of med-surg, and med-surg as a whole, but definitely the medications when it comes to med-surg. So you don't want to be caught in that. Like you don't want to be trying to take no extra class. You want to try to run through nursing school as fast as you can, child, okay? What else can I say about second semester? Med-surg is a lot of material. Now that part I can say, like I remember first getting the syllabus and I was like, what? It's a lot of material. So my recommendation for med-surg, how to take it on, is just don't put it to the last minute. Don't underestimate the material. Stay with it. Stay consistent. It comes fast. Like I remember for each exam, we have 4 exams. For each exam, we only had 2 weeks of worth of getting the material. 2 weeks. And then we had 2 checkoffs. We had trach suctioning, and we had, my memory is through. I don't remember the other one, but we had 2. Only 2 in second semester. So it gets the checkoffs, at least for my school, got lighter in second semester, but everything else picked up. So don't underestimate med-surg. Stay on top of it. Make sure you have a study plan. If you like to study with other people, do that. I don't personally like to do that, but just stay on top of it. Do not underestimate the material and get into your medications, because that for me was the difference between one grade and the next. Mental health wasn't bad at all. We got to go to a psychiatric unit, because I'm in Texas. I go to school in Central Texas, so there's a lot of like veterans and psychiatric things, and if you know anything about that, that kind of sometimes go hand in hand. So I went to a veterans psychiatric home. It was an experience, and I thought I was gonna be a psych nurse, and you know, y'all got that. Y'all got that. Yeah. No, you see how I'm stumbling? No, I can't do psych. So for the girls who do psych, okay, because it's not for me, and it's not for me. So, but anyway, we had that, and mental health just as a whole was actually not that challenging, but it's good to like understand diagnosis and, you know, how it affects certain different things, and stress and all types of stuff. So, I enjoyed mental health. I didn't enjoy going to a psychiatric place, but I enjoy mental health. What else can I say? Clinical. Let's talk clinical. So clinical in first semester is usually like geriatric, is usually older adult patients, because that's the bulk of what you're going to see, especially as a post-grad nurse. They're going to definitely try to get you in med-surg. They always recommend med-surg because you get that generalized experience of everything. So first semester with the geriatric patients, the thing about it is it's like so programmed, because they have these diagnoses that's not going anywhere. So it's the same thing, same cycle every day, and they're very stubborn, because you know what I'm saying, they're older adults. They ain't trying to hear none of that young stuff. okay, they're like, yeah, move. So you just see kind of the same stuff, and you see like end of life, hospice, comfort care, like, you know, what else can I say about it? I feel like it's very condensed. It's very condensed, and you know what to expect. Every day you know what to expect, right? So fast forward to second semester clinical, it's like a whirlwind difference. One, because you're in a hospital versus you're in like a I want to say a veterans home, but because that's where I went to clinical, but you're like in a, what's it called? I can't think what it's called, but you're in this environment that's kind of like structured a little bit more. And so that was a big difference. And then we went up to working 12 hours. So first semester, I think we were doing 6-hour shifts. And then now we're doing 12 hours. Yeah, we do 6 to 6, y'all. 12 hours a day for clinical. Yeah. So that was a big difference too. And just like, I was at a smaller hospital, like here in my local area. I wasn't at like our big hospital, but you know, just coming in contact with different situations, different disease processes, family members, you know, I don't want to say real patients, but patients who has tubings and, you know, need things like right now. It's not just like comfort care, and make sure like their pain is tolerated, make sure they're comfortable. Like it's actually more than that, you know what I mean? Like you actually have to put your knowledge to the test, like not just know it, but like, okay, you the almost nurse, what you can do, you know? So it's like a big difference. Now mind you, you do have a preceptor, so you're not just like on your own, like trying to figure it out. But it's a big difference. The paperwork never goes away, y'all. The paperwork sucks. It's stupid. Everybody, I feel like everybody in the history of nursing school hate the paperwork, but do it go away? No. So a bulk of our time was doing paperwork, which our clinical group and our clinical instructor was trying to fight that, because it's just like that takes up so much of your experience time when you're in the hospital, because there's so much to do when it comes to the paperwork. Anyway, and just like always be ready to you know, have a new experience, because I got to shadow the ED, and the ED is a stark difference than being on like a med surg floor. We was on med surg night and day. It's so much, the ED is so fast paced, like it's so boom 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 boom, and when you think you have to put your skills to the test with med surg, the ED is not gonna play with you. It's not gonna play with you. As soon as you walk in ED, you're like, go boom 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 boom, skill. I was like, oh my gosh, like I was trying IVs, well, attempting. I was attempting IVs left, right, and center, blood draws, chest compressions, NG, suctioning, trachs, every skill I've ever acquired in nursing school, I did that day. Med surg, you might do 1, you might do 2 here and there, like, you know, might do a little 1, 2, 1, 2. ED, you're doing everything. That's why I don't know why we don't shadow in the ED. Because when I say that day I felt like a nurse, that day I felt like a nurse, and my preceptor was so amazing. Like, thank God for him. Like, he had my back. But you actually feel like a nurse when you're shadowing, or you get into the ED. When I was on med surg, I felt like a PCT, and it's no shade. I'm not saying it like that, no shade. But I'm just saying, like, I didn't feel like I was in the full scope of a nurse until I got to the ED. So all I have to say is make sure that if there's an opportunity, you're on it. Like I was on it. Like I was like, even like outside of my preceptor, like I would see another nurse say like, oh, I'm going to do XYZ. I'm like, oh, can I go with you? Oh, can I see that? Oh, can I do that? Oh, can I? And that's how I got an ED, because I was like on it. Like it was the girls in there that like, ooh, I don't know. And I was like, yeah, I know. You need me over there? What we doing? Like, yeah. So just make sure like you're on top of it, and you'll be fine. Okay, what else can I tell you about second semester? Yeah, that's the bulk of second semester. Leadership was very challenging, only because it's a BSN class in an ADM program, which is stupid. It's stupid. It's like in nursing informatics. It's about HIPAA. It's about compliances. It's about technology, the EMR, the EHRs, all types of stuff like that. It's a BSN class. Like I literally was looking at a BSN program and the class was there. I was like, what are we doing? I guess it helped me because like, and for BSN I already have it, but yeah, it was so stupid. Anyways, there's a few people that did not pass leadership because it was way more challenging than it ever needed to be. What else? Yes, that is the bulk of second semester, y'all. That is really the bulk of second semester. So just my general consensus for me personally, I didn't necessarily find second semester hard, but I would definitely say the pace picked up. And it's your preparation in first semester that makes a difference in second semester. Don't go in there underestimating. Yeah, don't go in there underestimating any of the materials, especially in med-surg. Med-surg will literally smack you. Like, don't even try to play them games. So yeah, really for me that's it. I know other people have like a different version because med-surg be turning the girls every which way believes, and I'm fully tracking that. I'm fully tracking that. But just fortunately for me, like because I prepared in first semester, it makes second semester a little bit easier. So just preparation, y'all. And also the big difference is first semester you can get by with like just memorizing the material. Like you can get by with just like, you know, memorizing things. Second semester you can't. Like it's not memorization, it's what are you gonna do? And they even ask it, they're asking clinical questions. They're not asking just like, you know, is the sky red or blue? You know, no. They're asking it like, oh, this patient came in with this and you noticed this. What are you gonna do? Like, that's the structure of these questions in second semester. So like, you have to change your mindset along with it because it progressively like gets you to that critical thinking nurse mindset. So in third semester, we're gonna have case studies. So it's no more just, you know, just memorizing information like, oh yeah, I seen it in a book, there it is. No, it's like, okay, I know this, I can connect it to this, so if I see this, it should be this. Like it's so analytical, like it's so much more analytical, and I think that's the hard part. Like I think that's the differentiating like thing, especially with med-surg. Like that's what like really gets people, because people are still in that mindset of like the way we usually study, and you cannot do that, especially for med-surg. There's no more of that. That's gone. Like, and if you don't quickly like adjust your mindset, you're gonna fail med-surg because it's clinical application. So that's why I get other girls be like, oh, med-surg is so hard. I don't think it's hard. You just have to change your mindset, because it's more just what are you gonna do as the nurse. So there's that. Like my favorite class is mental health. I will always say that. I love mental health. It might just be the instructor. She was just the sweetest little thing. But I think for third semester it's gonna be peds. We're in OB-Peds, and I'm sorry for the baby. So like I think it's gonna be peds, y'all. The lowest grade I got, just in full transparency, was a 71. Yes, it was a 71, and that was in leadership. And now when I say it took my grade, I was like on the borderline AB. It took my grade all the way down. Like I was barely, I think I had 82, 83. Mind you, my nursing school program, you need a 78. So yeah, mind you, we only had one more exam after that, so I was like literally panicking. I was like, what the heck? And mind you, it was the easiest exam. Like I don't know how I dropped the ball that bad. I really don't know how I dropped the ball that bad. And before that, my lowest grade was like a 78, 79. That was my lowest grade. So that 71 smacked me. Like I remember sitting there like just blinking at the screen, like trying to adjust my eyes to the number, because I just felt like that truly can't be right. And everybody else like did so well on the exam, like talking about 90s, 97s, 99s, like high grades. I said one, and I was like, okay. So once again, don't underestimate material, because that's what it was. Because I knew it was so easy. I was like, I know this. Like, I'm good. I'm straight. Was the furthest thing from good or straight. Okay, y'all. So yeah, no. So. For hospital clinical, like I said, there is a big difference. So we're just gonna get into clinical a little bit. So, yes. So hospital clinical is a little bit different. Only thing I would say is like just be on your P's and Q's, and like be there with a sense of like humility, right? Because you're around experienced nurses, you're around nurses who didn't even get told that they're gonna have a shadow for the day. So like, you know, you might get met with a little bit of resistance, but it's not that it's anything against you. It's the fact that they have a heavy like patient load, and on top of that they have to be responsible for like showing you and make sure you understand, which takes more time naturally. And that's something that I had to learn, but there's so much experience there. Like, make sure you ask questions, make sure it's appropriate timing. Don't be asking questions to your nurse when you see like she in heat and she running this room, that room. Like, come on, use your brain. But make sure you ask questions. The doctors, the NPs, like anesthesiologists, I just talked to so many CRNAs. Like, just you're around so much experience. Like, you're around too much experience to not like be planting your seeds, getting your foot in the door, because you don't know where connections take you. Like, you just really don't know. And I'm gonna get into that in a second. But just always make sure you ready to get in there, you ready to do, you know what I'm saying, whatever it is, because that's how you get experiences. Like, I saw a surgery. I got to see a surgery in second semester. It was towards the end of clinical in second semester, and I was with a particular nurse who had a surgery, and they were like, oh, you know, your paperwork. I'm like, bump that paperwork. That's another thing. Don't let them make you feel like paperwork is a priority. It's not. You paid for the experience. Like, you paid for the pleasure of, like, no, I didn't pay to be sitting in this room doing paperwork. I paid for experience. So don't let them like try to bully you into prioritizing paperwork. Get your hands dirty. Like, nah. Watch out with that. And that, you know, that was my mannerism. Like, no, we're not doing that. Like, I'm going over here. Anyways, so on to my patient. He had a colonoscopy, and the doctors was so nice. The surgical tech was so nice. Like, I was literally standing right next to the surgical tech. The CRNA was so nice. Like, they literally, as they were going, they were telling me things. Like, they were literally teaching me as the doctors like cutting him open. They put the CHG, like, you know what I'm saying. They were funneling his colon. They took out a piece, like, and they were, you know, resuturing. Like, I was literally sitting right there. And that's what I mean by don't miss your experiences. Do not miss your experiences. So like, as you can see, like, I was in the ED. I was actually in the ICU. Like, I was in the ICU for a while. Like, they came and they got me, and they were like, do you want to just hang out in the ICU for a minute? So I got to be in the ICU. There's not a lot of beds in the ICU. I don't think I really want to do intensive care, but it was good experiences. They allowed me to, once again, be right there. That's how, you know, I got into it with the respiratory therapist, and seeing what they do in their scope of practice. And I was kind of hanging out with them for a little bit. So like that day, that clinical day was like fully packed. And that's why I say, like, I felt like a nurse that day, like, because I was doing everything. Like, they literally had me doing everything. I did blood draws, I did blood transfusion, I did every freaking skill imaginable. I was in the ICU. I met respiratory therapists, I met doctors, CNAs, just nursing experience across the board. Like, it was such a pleasurable day. And then I got to see the surgery, I think the next week or the week after. It was like really close after. I got to see that surgery, which was very cool, very different, very cool. And he was so nice. He was so nice. So yes, girl, don't miss opportunities. Do not miss opportunities. Like, that is the biggest takeaway, y'all. Get in there. Get in there. And there's gonna be the girls who be like hesitant, like, oh, I don't know. That's your opportunity to ball. Like, okay, she don't know. I know. Where we going? What we doing? What we seeing? Like, hello. So yeah, make sure y'all on that. 12-hour clinical days is hard. I ain't gonna say nothing about that. Like, there's times where I was at Starbucks 2, 3, maybe 4 times in a shift, especially when it's going slow and you're just sitting there just like soaking on it. So just make sure, like, all of the things, you get your appropriate rest. If you pack your bag accordingly, bring a jacket because it's always cold up in there. All of the things, yada yada yada. You stay hydrated. Y'all know the little ones and twos you need to do for a 12-hour day. Your feet are gonna hurt. Compression socks help me a little bit. I was wearing like clogs before I got my hokas. Anyways, those they were pretty comfortable with the compression socks. You'll be fine. Y'all be fine. Last check off. Oh my gosh, this is just my notes. I'm just guiding me a little bit. Last check off was trach suctioning. Yeah, it was trach suctioning. It just felt good to get it done. Oh, IV insertion. Those were the two. We did IV insertion and we did trach suctioning, and those are the only two that we had for second semester. But the last one was trach suctioning. It just felt good to be done with check offs. Like, I remember I went in there just like do like can't nothing bring me down. Just move. And like, I remember I was just in there like just overly happy. Like, whatever you need, like, go at it. And trach suctioning, you gotta be careful though, because the girls are dropping like flies, because it's a sterile technique process. So you have to be very, very careful, very, very meticulous. But I just remember being like, thank God we're doing. But like I said, third semester we're gonna have case studies, which is a whole different world. Like, I'm ready for it, but it's a whole different experience. Y'all, like, case studies, I just can't believe that I'm almost done. Like, oh, anyways, y'all, I'm gonna not reflect too much. And then that's bringing us closer to current time. So what have I been doing in recent days? So in recent days, I since second semester ended, your girl's been traveling. I did a little bit of traveling. I did a bit like R&R. Like I mentioned, I am doing my BSN classes because I literally want my BSN right after RN. Like, I'm running. Like, I'm not talking about it. So like, I've been taking BSN classes. So I'm currently taking stats, patho. I took Texas government and speech. So yes, girl, which will leave me with an arts class, a micro. That's it. An arts class and micro. Which I'm gonna take micro fourth semester. Like, I'm scheduling it for fourth semester. So that's what I've been doing on that tip. And then I actually got a student nurse tech job, y'all. So let's get into that. So my school collaborates with like the local hospital and allows us to work as nurse techs while we're in nursing school. The only criteria is you have to have your first semester of nursing school completed, like fully completed, past everything. Once you do that, you're eligible to get into the nurse tech position. So I had 2 interviews, kind of spread out actually, but the first one was just like general questions, using the STAR method: situation, task, assessment, response. I forget, but it's kind of like that. So you have to like structure, like, here's an example. So like the question was like, name a time when you had to handle a difficult. Okay, y'all, my SD card is full, so I kind of have to like speed it up. But I think my answer to the question was, oh, so the situation was, there was a patient, he was a little bit unruly. I didn't understand why. The task was I was going in there to get his vital signs, and the assessment was, the psychological need. Hey, what's going on? This is a little bit out of character. Are you okay? Can I help with anything? Do you need comfort? And it was just a matter of like, and this is a real story, but I curated it, and it was just a matter of like, he had a restless night. He was tossing and turning, he felt uncomfortable. So just a matter of like understanding his psychosocial need and understanding that, he just need comfort measures to kind of bring him back to baseline and bring him back to what we know. So that was like the structure. That was the question, and that was kind of the structure they wanted. So that was the first interview. And then the second interview was like more stringent. They asked more questions, more like clinical based questions. They asked like, oh, what would you do in this scenario? How would you handle this patient? Have you experienced this before? You know, what would you do with a difficult coworker? Da da da, like things like that. It was not too bad. And they basically told me I got the job without telling me I got the job. So I left out of there and be like, yeah. So I kind of been doing that for a month, and it's a different world. It's nothing like clinical. Like you're actually, so I have 4 PCT shifts, which I shadow the PCT, which I love a PCT. Like my hug stays at my side. I love a PCT. And I had 2 nurse shifts where I actually shadow the nurse. And I've just been around so many great black, yes, experienced nurses, and I love it. I live for it. Like it literally just, it's unmatched. When you find community, especially in healthcare, as a black woman, child, you be jumping for joy. When I say like all of my preceptors have been lovely, and it's paid. It's a paid externship. And I will still be required to work while in school, which is like 1/3 semester, you know, kicks back up, which is no problem. It would just be 1 8-hour shift per week. So I'm like, that's fine, that's fine. I think I can like make do with that. So like I said, I've been doing that for a week, and it's so different. It's so different. You work in them 12-hour days, and it's nothing like clinical. You're not doing no paperwork. You're literally just there, like boom, 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 boom. You know, I'm with the PCTs helping them out. You know, do bed baths and changes and going to the bathroom and whatever they need. I'm with the nurse. You know, I'm dropping lines. I'm priming bags. You know, I'm doing all these things, getting the pump ready, blood transfusions, like, you know, communicating with doctors. So it's just like, now I feel like a nurse. Like in clinical, I don't really be feeling like a nurse. Like I be feeling like a PCT, but like since I've been doing this, y'all, I truly feel like a nurse. You know, I've done bereavement, you know, I've done like putting patients in the bag and, you know, tagging them up. You know, I met with coroners, not the coroner, the people who come get them and take them to the morgue. You know, conversation with them, respiratory therapists, seeing what they do in their scope. You know, so it's just a lot of experience. So I'm not really sure. I don't have my schedule, but in coming days, like I will be float. So, you know, I'll be like cardiac units, ED, ICU. I think like all the kid stuff is off limits for us in this specific role. But if your school offers student nurse tech positions, take it. Take it, take it, take it. Like I would always recommend taking it. One, because the experience, like you don't want to miss out on the experience. Like, and it's not a competition, but at the same time it kind of is. So if you can get a leg up on, you know, somebody right next to you, why the heck not? So always take it. I recommend it. I really, really, really enjoy it, and it's paid. You know, like come on, and the pay is actually, that's all I was saying on that, okay? But yeah, I've just been, that's really what I've been doing. Like summer classes working, travel, R&R, trying to get things ready, because I know 3rd semester is gonna fly by and be a 4th semester, and trying to figure out like really what's next for me. So that's what I've been doing in recent days, y'all. Did I miss anything? Yeah, it's a different feeling to walking in as an employee, having a badge, child. It was so different. Being the PCTs, you know, meeting the nurses, you know, bonding with them. It's literally different world. Like I've meshed so well though. Like they are my girls. I love the girls. Like it is, it's very enjoyable. It's very enjoyable. Only thing is like you don't chart, you don't do any kind of like assessments. Well, at least I don't chart, do any kind of like assessments. Like that's out of my scope. But yeah, girl, do it. Just do it. Like what else? Yeah, y'all, that's really just everything from the end of first semester up until now as far as school goes. Just on a personal tip, y'all, just been trying to get my life together as far as like in the gym, staying consistent, locked in with the gym. You know, I am a Pilates girl at heart. If you don't do Pilates, I don't know what you're doing. Just get the membership. Like, I love a Pilates day. I love a hot scope. I love a diddle daddle. I love a matcha. Like, I've just been enjoying being a girl. Like, I've just been doing a lot of traveling, a lot of like curated experiences, y'all. So just really, you know, living the nurse's lifestyle before actually being a nurse. Okay, I've just been elevating, okay. And really that's it. Like, that's the big thing. I'm looking because my freaking SD card will cut off on y'all. Yes, so y'all, we're all caught up. We are all caught up. It brings y'all literally to right now, Sylvia. Like, literally. I haven't really done anything. No, I haven't done anything else. So just my overall consensus as far as like school and where I've been, child. I've just really been, I don't know where I've been. I don't know. Like, I really just been going through the motions, and like I said, second semester really picked up on me, and I just felt like I always had something to do. Like, there was always an exam, there was always a check off. Well, we had 2 check-offs, but it was just always something. Especially when we were taking more classes, so I just felt like it's like boom, 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 boom. So yeah, like, girl, I was just like, I got time for this recording stuff. Like, literally, I'm like studying exams. But now I have a little bit more time. I'm definitely trying to get my bag, y'all. Like, I'm trying to come back. Don't hold me to it. No, I'm trying to like come back and really be with y'all because I miss y'all. I really do. Yeah. I am really excited for the next chapter and like whatever it is to come. Like, I'm ready for third semester. I'm ready to get things just knocked out of the way. I'm ready for BSN. I'm ready for post grad. I'm ready for what's next. I don't know if I told y'all, but LND, like, I want to be a maternal health advocate, especially for Black women. Okay, so that's kind of like my path. That's, you know, what I'm aiming to do right now. I'll get more in depth with y'all in later vlogs, but if y'all want student nurse tech vlogs, if y'all want to see like day in the life as a student nurse tech vlogs, I can do that for y'all. If y'all want weekly vlogs, I can do that for y'all. My week always looks like studying, job, diddle daddle, literally. Literally. But anyways, I love y'all. I miss y'all. I hope y'all found this little where have I been useful, because I've been gone for months, and what really brought me back is like, I got a new subscriber, which thank y'all. I know my community is small, but I appreciate y'all. I got a new subscriber, and I was just like, oh my gosh, I have not picked up the camera in how long? And I started smiling. I'm like, yeah, you need to record for the girls. What are you? Is you cool or what? So that's why that's why I was like, yeah, let me go ahead and make this video because I have a lot to tell y'all anyway. So anyways, I love y'all. I hope y'all enjoyed the video, and I will see y'all on the next one.